Good morning. Good morning.
Good morning.
You're welcome to today's lecture on the course PHP, Physical and Health Education, PHP 101. PHP 101. Today we'll take a look at factors that determine one's health. Factors that determine one's health. So here we want to look at different factors that determine how healthy one can be. So the health state of an individual is actually determined by many factors. In fact, it's a complex interplay of different factors. So these factors can be categorized as follows. We have environment. The environment. So the physical environment of an individual goes a long way to determine the person's health state of health. So the environment where the individual lives, where the individual works or plays, can have a significant impact on the health of the individual. Example, the food obtainable from the environment, the food you eat, the food in the environment, the air, the water in the environment. How is the water? Is the water clean? You know, in this era of cholera, you know now, if you are not careful with the water you drink, you may contract it. True of us.
Sure.
Good. So, have you now seen how the environment, the food you eat, is not everything you eat. Be careful about the hygiene. Very, very, very important. So, the quality of water, even the housing condition, is also one of the factors under environmental factors. And also access to green spaces. Do you understand what I mean by access to green spaces?
No.
Good. It's healthy to have trees in your environment. Why? Why do you think it's important?
For proper oxygen flow.
Good. You know
It's contributor.
you know your biology, photosynthesis, right?
Yes.
What does plants take in?
Carbon dioxide and they respirate as oxygen.
Good. Oxygen comes out, right?
Yes.
Carbon dioxide. But we, animals, what happens?
Taking the oxygen.
Oxygen. So now, if you don't have plant around, trees around, there is a very big problem. Because the time will come, the atmosphere will be saturated with what? CO2 from you, CO2 from different sources. Three of us. So it's very so the plant help to mop up these CO2. So it keeps the atmosphere clean. Am I communicating? Good. Now, so the housing condition and access to green spaces, very, very important. Now let's look at biology. You can say biology, and another factor now. You can say biology, physiology, anyone use this, okay. So let's look at the biology. So the individual makeup, biological makeup, goes a long way to determine the person's health states, especially the genetic makeup. You know, there are some diseases, there are some people that maybe because of their genetic makeup, they are they are prone to a particular type of disease. True of us. Yeah, there are people that diabetes, only the diabetes is just genetic. The only thing they need to do is to watch what they is to be careful about their lifestyle, so that at least the manifestation may take time. From their, it comes from their father, their great grandfather. They have this, it's just in their gene. But the environmental, whatever you show today on my face today, we have the nature and nurture. Nature, by hereditary, the person has the gene that. But if the person is careful about what he eats, lifestyle modification, and the person may even develop it very late in life. That is, if the person will get that old before the person dies. But if the person doesn't care about what he eats, lifestyle, and everything, and what he does, the person will manifest it as early as possible. Am I communicating? So that's the point I'm trying to make here, that the genetic makeup differ. There are some people that may be prone to a particular type of disease. Have you not seen how the biology of an individual can lead to the person developing a particular disease and being in a particular health state? Right. The next factor I want us to look at is the gender. Under gender, the gender of an individual plays a significant role also in the person's health states. There are some by gender will mean the sex now, right? Male or female, feminine or masculine gender. Now, there are some diseases that males are more prone to. There are some that females are more prone to. There are many of them. Am I completing? Now, it has been research has shown that males are more likely to experience cardiovascular. It's not that female don't experience cardiovascular issue. Are more likely to experience develop cardiovascular issues. Or what do you think could be the reason? Any idea? It's not one factor. Just let me just what do you think should be the? Can we talk about the burden of
responsibilities carries?
Can we bring that in?
That's the only one that's never.
Now there are also some things that women are prone to more, like depression, anxiety. They withdraw more, right? Unlike men that they just come out and talk about it. Majority of females are more. They will put everything in their mind and be pondering and start going down their own without even consulting, asking questions. It's only few that will just tell you, now this is it, I don't like it. Okay, how do you go about this? Most of them will just go inside. And if they see, they pretend that nothing is going on, but they are dying. Am I communicating? So, have you not seen that the gender, there are this just one or two examples. There are many examples of course, anyway, even by the virtue of their body makeup too, males, females, now, talk of breast cancer, even though yes, you can see, but majority of females, prostate, male, majority, am I calculating now here? So, now, next one, the next factors I want us to look at is generally we look at lifestyle. Very important. Your lifestyle plays a vital role in your developing, in your being in a particular state of health. Lifestyle. An individual's lifestyle choices. can determine the person's state of health. Lifestyle choices like diets. Do you diet? Do you take back diet, or do you just anything you see? So far as hunger, okay. You wouldn't mind eating bread from morning, afternoon, night. Let it quench my hunger. You wouldn't mind eating noodles for complete 1 month. All you know is that let the hunger do what? Go. That's what you care about. You don't care about making sure that the food you eat is balanced. Am I communicating? So diet is very, very important. Then physical activity level. Some are, do I even call them sedentary animals? Some are just, they don't even care. They don't know what is from here to here. They just enter keke bike from here to here. Just to train from here to here. Do that because I don't have the strength. From morning till night, you live in the office. You live in the all the time. They can never be bring out. Okay, since you cannot, the nature of your work, you always be in a vehicle or in your office from morning till night. You cannot just make out a day to go to gym to go and no, that one is not for them. It's very, very bad. So your the level of your physical activities goes a long way to determine your state of health. Of course, if you don't exercise, you start developing a lot of issues. I'm not communicating. Yes. So your physical activity level at the same time, even your smoking status. In fact, it is now very clear that smoking leads to cancer. It's now very, very clear. It's no longer it's not clear that it's not the issue of they're liable to die of. It is cancer. The issue is not just you that is smoking it. Even people like even secondary people around you can even develop cancer with time. So you see, it's not just about you alone that is smoking. It's people around you. Even though they are selling that smoke, that cigarettes. Even the person that owns the shop that is there, children will just be there playing around and smoking. Small time you say that they are the child, a child of so number of years has cancer. Wondering how, when, why, So now smoking is dangerous, very, very dangerous. But some people don't know about it. Most people don't even know about it. So the diets I have, another thing is that in terms of diets, I think I mentioned this in this class. Dieting on food containing high processed food is not good for your system. Please run away from that. A diet that is high in processed foods and sugar. High in processed, yes, we know you need sugar. But even the normal food you eat has sugar. True of us. Normal fruit you take, they have what? Sugar. True of us. Good. But you see those processed ones, run away from them. So any diet that is rich, that is high in processed food and the sugar disappear. You should remove them from your diet, because it can lead to increased risk of obesity and even other health issues. Cardiovascular issues can come in, even your arthritis can come. True of us. Apart from rheumatoid one that is immune, whatever, there are other ones, forms of arthritis can come in. Am I coming? So you should be careful about what you eat. In fact, what you eat today, take this from me. You see this your youthful age. What you eat today, from your childhood stage to your let's say 50 for something years, determines how your 56, 70 will look like. It's not it's a reality. What you eat now determines how your 50, 60 will look like. What you eat, food, diet, and exercise. You don't exercise, how you look like that time. Whether you working like this, or whether they will suck, your knee, your joint will be somehow, you are, in fact, you are the synovial joint here, the synovial fluid there will disappear, and the cartilage, the two of them will be am I completing? Arthritis, cardiovascular issues, diabetes. By the time we go over to aging, care of the age, you understand better what I'm talking about. So let's be careful about what we eat now. Very important. Now the next one is income. Income. Do you agree that an individual's income economic status has a lot to do, affect the person's health? Except someone that is knowledgeable, even though you are trying to go, there are still some natural food that are not even at its base. Of course, you can still get. But the worst part of it is that you are poor, and you are poor in wealth and in knowledge. That one is even the worst. Am I completing? Something that let me just buy noodles and eat. That noodles, if the person have access to, if the person can even, that noodles can even, that money for that noodles, there are other natural things the person can get and eat and be okay and eat healthy. Am I completing? That's what I'm trying to make. But generally, apart from the issue of diet, generally, if someone that is poor, that is struggling financially, is prone to health issues. Do you know why? Because the person may not even have the money to go for health checkup. True of us. Because if something happens at that time, because may not even have money to take care of for hospital bills. True of us. And once you don't treat yourself, other issues will start coming up. True of us. So that's how the economic and the income of the individual affect the person's health. So an individual's income level can also affect their health state. So those living in poverty are more likely to experience poor health outcomes. Yes, they are more likely to experience poor health outcomes. Why? The reasons are as follows: limited access to what? Health care. True of us. Limited access to what? Health care. Then healthy food. I think I mentioned it. Healthy food. When poverty combines with ignorance, then that one is graveyard. True of us. Is stress. That one is straight to the grave. When ignorance is combined with what? Poverty. Straight to what? Grave. Because the person won't even know those small food he can buy, he can get to and eat well. Then also even safe housing. Yes, because someone is poor, the person will see himself in a particular house that maybe the compound or even the house is not even that, but the person has to stay there because he doesn't have money to get a group or place to stay. True of us. Even if the person want to, the person himself is conscious of his health, but because the person has no money, the person may go and rent an accommodation in a public yard, face me and face you. They are using the same toilets. I mean, I say it now. Personally, the person has no issues. The person maintains hygiene. It may be one human being from nowhere can transfer the infection. True of us. Because no matter how you want to keep the toilet clean, once the people that stays in that yard, they don't understand what they are doing, you may contract that what? Because it may be something, it may be an outbreak, it may be something that is highly contagious. Just because you are staying in that particular compound, innocently, you do what? You contract it. That's the problem. So have you not seen how the person not having enough money let the person, even if the person doesn't control it, the children may, the innocent children, will you lock them up in the room all the time? Would you go to work? So if they come back in the afternoon, wouldn't they play with the children in this compound? You see some children, no matter how neat their parents, just because of the type of place they are, they live. In the night, they start seeing skin infections on the body of their children. They'll be like, well. So that is a problem. So income goes a long way affecting, determining the person's health state. Now, social support. Let's look at social support. So an individual social support system network, including the family, friends, can go a long way affecting determining the person's health state. True of us, especially mental health. Especially what? Mental health.
So I would say other life choices.
No, we are not social support. We treated lifestyle, we started from environment, biology, lifestyle, what again? No. Environment, biology, lifestyle, what else?
Access to
No, that one is under environment.
Gender.
Huh?
Gender.
Gender. What else?
income level,
Income level. What else?
social support.
So we are in what? Social what? Support. So social support. So an individual social support network, including their family and friends, play a significant role in determining their health or state. For example, now individuals with strong social support, they tend to experience better mental health outcomes. True of us. People come around, ask you how you are doing, discuss with you, you share your problem with them, and they help you to really look for a way to solve the problem. The mental health outcome will come out wonderful and true of us. But when you are passing through some situation and nobody is there to even talk to you, if you say the only person that will talk to you is the person that will even make your case worse, true of us, then the person's mental health will start. And if remember I told you how important mental health is. If mental health is not well cared for, the person will start developing even physical issues, pathophysiological issues, cardiovascular system issues. True of us? Yes. Stress, emotional stress, another thing will start coming up, and they will definitely translate to what? Being hospitalized. Yes, some even slump and die. Yes, just from mental health. So that's why mental health is very important to check our mental health. Now, on a general note, access to health care. Access to health care, in the other one, when we discuss income, we mentioned low income limit access to health care. Yes, but here now we are talking about access to health care on a general note. Now, you may have the money, you may have at least the resources, but you may not even see a good hospital to go. True of us, won't it limit access to health care? Or you may even see a very good hospital. You may even see a health care center or hospital. On getting there, the personnel we are in this field now. People there are not serious. True of us, they don't even attend to their patients properly. Do you have access to health care? Do you? You don't have access to health care. Yes, they are there. This guy died there, but they did nothing. Some may even come to work in the morning and disappear. Some may come to work twice a week. Especially most of the government hospitals. Some may come twice a week or once a week. Some may even come at all. And at the end, they will collect what? Salary. True of us. Then people there. Yeah, we have a health center there. But do they have access to health care? Because if they go there, they will not see a doctor. The nurses there will just be doing what they like. Pharmacists may come once a week. If he or she come at all, the person you will see only pharmacy technician, or that is some pharmacy technician may even learn from pharmacy, they will not be coming. Some community health worker there they will disappear and go there to business. True of us, they will just be doing what they like because nobody is monitoring them. Now, people, I'm just painting a scenario now. The people in that community, would you say they have access to health care? On paper, officially in the office of the Ministry of Health, they have access to healthcare, but on ground or in reality they have no access to healthcare. So there are many factors. So individual access to healthcare services. Listen carefully. Individual access to healthcare services. It's not just about having money now. It's the services. Services is now the issue. Individual access to healthcare services, including preventive care and treatment of both acute and chronic diseases, can also impact on their health state. You agree with me, right? Good. So if you also take it from the point of view of what is it called? If you also take it from the point of view of not having money, some may not even be insured. True of us, some may not enroll in the health insurance due to one reason or the other. Maybe because they don't know about it, or because maybe they feel that it doesn't make sense, it doesn't worth it. True of us. People have their own different understanding. Some is like calculating. So if I don't fall sick for a whole year, all the money they're taking from my account will go like that. Some people think like that. You know how health insurance works now? Are you aware? Do you know how it works? Just like normal insurance, but here now, if you register. If you know, maybe as is through HMO or whatever, the specific amount of money will be taken from your salary, or you contribute a specific amount of money every month. If you fall sick, the same all the people that enroll in the all the clients that enroll in the scheme, money will be deducted from their paid from their monthly from their salary, or they will contribute money. There's a central pool where all the money will be entering. True of us. Now let's assume that we are only human beings in this world, for all of us here, and we enroll in the insurance. Then money will be taken from you into the account. In a year, none of us will fall sick. True of us. And it continue like that. You may fall sick. From that money, there, they pull money from there. You pay some percentage. You may pay like 10%, as case may be, depending. Then the remaining 90% will take it from the pool. Am I completing? So next month she may fall sick. But if nobody falls sick, the money will remain there. Am I completing? Now, the issue now is some people may start thinking like this. So if I don't fall sick now, all this money they'll be like, I'm not doing it. Then those that register will be like, okay, my money will always, they will start forming illness. Am I communicating? So as to get their money back. Nowadays, you must see a doctor. A doctor must prescribe that this is what the patient actually, that this one is a patient, not just a client, it's a patient, and this is what the person needs. If not, they will not listen to you. So the point I'm making is this: some may even be aware of the importance of the insurance, but they refuse to. Am I communicating? So whether irrespective of the cause, as not being insured can affect, because you may see there may be a kind of a treatment that you will not be able to pay, maybe because of their financial status at that point in time. You will not be able to pay for that. Like that, one of my friends in my former school, the person had a very serious surgical intervention procedure that amount to almost 500,000. No savings. It was through what? Insurance. She just paid a little amount of money, and the surgery was carried out. So had it been the person did not enroll, tell me where they get the money from. Am I communicating? Now tell me where would they have gotten the money from? So this can also affect the person's state of what? Health. Alright, so let's move on to another thing. Let's look at the aims and objectives, principles and scope of health education. Aims and objectives, principles and scope of what? Aims and what? Objectives, principles and what? Scope of what? Health education. So let's look at the principles and aims and objectives. Let's look at the aims and objectives. Primarily, the aim of health education is to improve the health and well-being of individual, community, and the entire population. Individual, community, and the population. Tell me where you are the department for falling into. Population, right? Public what? Health, right? Public what? Health. Individual, community. What of community? What of individual? Because one-on-one, the patient is still with you now. Right? One now. The patient is no longer a client. He is now a patient. Sitting there one-on-one. One treatment. You are doing to a particular patient now. Am I communicating good? So the aim of primary aim of health education is to improve the health and well-being of what? Individual, community, and the what? Population, the entire world population. Now let's look at the specific objectives of health education. The specific objectives of health education. Hope you know the difference between aims and objectives. Are they the same thing?
Yes.
She said yes now. Aims and objective are they the same thing?
For the aims, health education. For the aim, the aim is referring to what is expected, what is the target of health education.
Okay.
But the objectives, I don't know what to say.
Gotcha. Oh yeah, answer me. No, he can. He's not true.
The objective is the purpose of, it refers to the purpose, like, you understand?
Okay, yes.
It's not true.
It's the purpose now.
It's not true. It's not true.
Aims is what you are targeting.
So
Objective.
purpose and what to target.
Why are we targeting this?
Is that what? You know, when it comes down to objective, you are now breaking it down. What are what you are doing? What are what? You know, a kind of aim is more like it's more universal. Here, if you come here now, what is your aim for coming to even this place entirely? Is for you to be a what? Do this and graduate, right? And get your certificate, right? Or to even be able to get certified as a public health technician and be able to make a living. True of us. Now, when you now in that your aim now, every day you come here, you must have a particular what? A mind. True of us, or what you want to do, what achieve. It's all those things you are achieving with time. that will culminate to reaching that your what aim. Am I communicating? Good. Now,
What's the difference between purpose and what you want to achieve?
This is why I want to do this.
And the achievement is
What I want to do.
you don't like.
is it clear now? Okay. Here now, by February now, you write your exam, right? And for you to do well in that exam, there are little things you need to do every day. For you to be able to do well in your exam. True of course. Now, if you don't do that small thing, you should be doing every day. Every day that you should. What are those things you should do? You should come to your class, right? You should take notes, right? You should get your course material. You should study when you get to. If a day passes and you fail to do all these things, know that you are that 100%. You are supposed to. You are targeting is going down. Are you aware? It's going down. Tomorrow again, you fail to do what you should do. That is going down. And if you don't realize yourself, by the end of the semester, you see yourself getting 40. Because if you look back, there are things you should have done on daily basis. You do not do what? You do not do what? You don't do. You cannot wake up from boom, slumber, maybe towards the exam and think you unless, and if it happens, something is wrong somewhere. If it happens that you just wake up, boom, and score 100, something happened what? Somewhere. It's not possible. It's not possible. Something happens somewhere. In my course, it's not possible. It's not possible. It cannot happen. Because every day, what we are doing is being recorded. So there's no way, it's not possible. And that is how life is. So now let's now go to the specific objective now. We talked about the aim. The aim is to do what? Improve the what? The health and the what? Well-being of individuals, community, and the what? The entire what? Population. That's the aim. Now let's look at the specific what? Objective. Now, the specific objective of health education are as follows. Number one is to increase the knowledge. Listen carefully now. Increase the knowledge and understanding of health and health-related issues. Do you now understand? Because what are you doing now? Yes, you want to improve the well-being. On a general, what you want to do is that you want to improve the well-being of the people, right? Now, the objective now, first is to increase the knowledge. So, it's when you now meet that individuals, either at individual level, community level, or population, or the global level, to tell them about what? Give them, help them to acquire knowledge about how to take care of themselves. You are actually, it's when they know about it, that's when they will now start doing things that will improve their what? Health and well-being. So this is what you are doing now as a health educator. This is now what you are doing to be able to achieve that what? Aim. True of us. Good. You cannot say, I want to improve. You come and say, you come on the national territory and say, our aim is to improve the health, well-being of the population. Then you now go and start selling granules. Tell me how you will. Tell me how you will improve it. Granule is even okay. Say you go and start selling clothes. You appear on the national television and say that I am a health care professional. I am a public health practitioner. Our aim, the aim is to improve the people's well-being, right, and health. Then after that, now tomorrow I will see you selling clothes then. Instead of organizing programs that we need to educate people about their health and what they should do to live healthy, tell me, that cloth you are selling, is it an objective that help you achieve the aim of improving their health? Is it? Is it? Eh? It's not. It's not. Or you're gonna start selling food after talking nonsense. You go and start selling food. What you are doing should be in line. Like me now, I'm here. Yes, I'm not in hospital, but I'm here. What I'm doing here now is in line with my aim of being a health professional. The aim is to help people improve what? Health care, right? I'm here now. What I'm here doing, I'm training you, the students. If I train you now, tomorrow you go and start practicing. Am I actually in line? What I'm doing, my objective now, is it in line with achieving that aim? It's in line with it. It's in line with it. So that's what I'm trying to make. So that's why I would say that one of the specific objectives is to promote to increase knowledge and understanding of health and health related issues. The next one is to promote healthy behaviors and lifestyle. Healthy behaviors. Do you know why I'm taking time to talk about this? If you watch, I'm bringing it down. A lot of people don't understand. There's a question you see tomorrow, they will ask you aim separately, they will ask you objective separately, you'll be confused. Some things that are not the same thing. They are not the same thing. Objectives are what you are doing on daily basis, or programs you have, things you have to help you achieve that purpose. You say you are a married woman, right? And you want a peaceful husband, a husband that will not raise his hand on you. That's what aim, a peaceful home, right? If you don't want the man to beat you, don't want the man to do things that will hurt you. A peaceful home, that's what you want, right? That's your aim. Then when you now come for you to achieve that aim, your objective, if your husband talks to you, you do what? Keep quiet. Listen. Two of us, if you say come, answer him. If he talks to you, don't talk back at him. Two of us, if you do that thing, you will achieve the purpose of a peaceful home. But you profess that you want a peaceful home. When you say, baby, come, I'm not coming, leave me alone, you useless man. Will you achieve the purpose? Your eye will be like this. Two of us. So your objective should help you achieve the goals. Let's continue this. Now, the next one is to improve health outcomes and reduce health disparities. Health outcome. You are in hospital, saying that you are working. You are you are a doctor, or you are a pharmacist. You don't really care much about the health outcome of your patient. All you know is just to blow them drug and go your way. Collect their money. And if that one is rampant this time around, I don't know why. I don't know whether some of our hospitals are just there to make money, or they're actually there to help patients. I don't know what they're doing, but it's becoming rampant now. That's you will see some people they don't even care about, but there are still some good ones that will listen to you. Want to know exactly, in fact, follow it up, know exactly how we are doing and everything. But so don't care. All you know is that once you have paid, it does not concern them. I'm not committing. There are still some good ones. At least I've seen. I can testify. They will follow you, or yes, they need money, but most of the things you see them do, you convince that what they actually care about what the outcome of whatever that is happening here. All right, so now let's look at principles of health. Say to improve health outcomes and reduce health disparities. You have these things in your handout now, in your course materials now. Okay, you want the one that comes from my mouth. is something. Okay, no. Number 2 says to promote healthy behaviors and lifestyle. If you go for outreach now, I've told you how I go for outreach in schools, tell the students about their health and all those things. Yeah. Yes, in as much as I'm in lecturing line, I make time to do that one. It's also part of what lecturing too, training too, tutoring too, even though it's not class work, but at least it's health work, education. Go out, meet, discuss with the school authority. They fix a day, go there, speak with the students, tell them what they are doing that is not helping them. Am I communicating? That may have effect in their later in life, ranging from what they eat and other things. And you see their eyes open, they be like, so this is not good. They will start changing on time, so that they will, basically we must age. We must age. We must get old. But please, you can still get old in peace. 3 of us. Yes. You can still get old in peace without causing issues to people, to your children and your grandchildren. Because you are getting old, their money will do what? Finish, because you are getting old. Abba. You can still get old without causing economic issues for them, because they cannot leave you now. They will keep flying you from one hospital and spending millions because you are getting old. Whereas most of them is what you greater percentage are your lifestyle, what you keep taking. Number 1 is staring at me here. You see this thing, limit it. You're looking at me, I see you almost all the time with it. That's why I'm talking like this. Yes. Before now, I told you something that what you do now determines how you are 60-something years from now will look like. There's no loss about that. It's reality. Whether you just get old without developing all those things, all those chronic diseases, all those things that will make you suffer and make people around you to suffer. So please, it's very important. We start from ourselves. We that are health line, we start from ourselves. Yes, we start from ourselves first. Because if you live healthy, that's when you can convince people that it's good to live what? Healthy. I thought I gave you an example sometime ago. You say that you are going for health talk, or you are going for outreach, and you want to go and talk to people about how they prevent chronic diseases, and you are carrying your knees are paining you cannot walk, and you say, please, you need to look at that. This one is not serious. So where are you? So how come? Did you just become a healthcare professional yesterday? So why did you start from yourself? That's the point I'm making. Please, let's work on it. Now let's look at principles of health education. Principles of health education. So health education is guided by key principles. Health education is guided by key principles. There's a principle that guide health education. So whatever you are going to do in the name of health education, you should be guided by these things. Don't overlook them. That's the point I'm making. When you talk about principles now, okay, you're talking about guide, what you should not overlook, what you should make sure that you put in place for you to be able to do what? Achieve what you want to do what? Achieve. 3 of us. What are those principles? Number 1 is that principles of what? The principle of empowerment. Principles of empowerment. What is this principle talking about? Principle of empowerment talks about the importance of, see, I want to put it together. You know that. Let's assume this is a health talk. You know, under health education, now it's through health talk that you give you educate, right? Health talk is health education is just general. Hope you know. Health education is what? General, right? But when you talk about health talk, now you're now keeping poster that talks about a particular health, whatever, how to prevent some things. Is that not is not health education? Is it health talk? Is it health talk? Writing something and posting on social media, is it part of health education? Is it health talk? It's not health talk. Do you not understand what we are going to now? Now let's assume now you are health talk now. We are health talk session now. Now, whatever I'm going to teach you or tell you, I'll try as much as possible to empower you, not just to talk. Because if after talking I will go, right? What happens after when I go? I should train you, educate you in such a way that you become empowered to the reason that if when I'm done and go, you can start implementing those things on your own. You take responsibility of those, implementing those things by yourself. If you're able to achieve that as a health educator, that means you know what you're doing. I don't know if you are understand what I'm saying. You should be able to. The same thing happens here now, even as a lecturer. If not by my power, but by God's grace, and also I'm intentional about it. Most of the students I've handled, most of them come back and say, "Sir, it's you that made me to even know that you can sit down and study. It's you that made me to even realize that one can sit down and do what? Study." It is called empowering the person. And you cannot empower somebody if you're not firm. Because this our body is weak. You want it the easy way. We want it the easier way. We don't want to solve ourselves. But if you empower somebody, even if the person doesn't see you again for life, the person who can stand on his or her own and start doing what? Doing that thing because of how you were able to make the person learn that thing. So the point I'm making there is that as a health educator, you should be able to, those you are training or educating should be able to take responsibility of doing those things. Not just after that they will go, you go, no. So that's what the principle, so you should ensure that whatever you are doing, that you empower them to be able to do what? Do that. So this principle emphasizes the importance of enabling individuals and communities to take control of their what? Health. It emphasizes the importance of enabling the individual or the community, as the case may be, to take control of their own what? Health. Very, very important. It's a very important principle. Because you will not be there all the time, two of us. Then the next one is the principle of participation. Principle of what? Participation. This one also emphasizes the importance of involving not just teaching them, making sure that you involve them, involving the individuals in the implementation of health education program.
Is it under the principle?
Yeah. It emphasizes the importance of involving individuals and communities in the planning and implementation. Put planning first. In the planning and implementation of what? Health education program. Let's assume now, are we together? Let's assume that I know that there are some things. Let me just go to generalism. There are some things I may be doing for you, or even as a lecturer, with respect to the course you have, our course. And I don't explain some certain things I'm doing, maybe with respect to your quizzes, how I complete it. That's why if you watch, after every quiz, I send you everything, you see it. You see the grading. You see this is the first quiz, second quiz, and you see it every week, right? You see it. That thing, there's something, it improves participation. Am I committing? There's something it puts in you. Why that to be like, okay, this is how he does it. One. Secondly, hi. See what I'm scoring though. I'm not doing well though. You see the progression, right? I am not doing well though. Hi. This one, hey, this person I scored 10. Hi. I will struggle to score up to 20. Because you, as you're studying, you are anticipating to that I will pace another one, right? And you want to score up to 20. You start studying. Three of us, because you know that you will see the next one. Next one, if you now see 18, you say, hey, I have arrived. I'm doing well now. You see yourself improving. But if you don't see all those things, you relax. You will not participate in what is going on about your CA. You won't even know. You will be gallivanting until your exam, until you see your final result, you see 40. You say, how? But if you're going to score 40, you see you are 40 with your good eye. Every week you are 40. Will be staring at you. That's why I say that if you fail my course, you decided to do what? Fail. Because you see the failure every week coming. You see red. First red, second red, third red, fourth red. You don't feel to do anything about it. You already know that you fail. Three of us. So now, when you are bringing this thing now to what is discussed, you involve the people, those you want to educate in whatever that is going on in the program. They will follow up, and it will also help them to be empowered. It has a link to the first one I said. If they don't participate, will they be empowered? You see, it's another way of getting them empowered. Allow them to participate in what is happening. They know about what is going on. Why you are doing, if you explain some certain things to them, they know why you are, the reason you are explaining that thing to them. The reason you want them to know about this one. Because if you don't know about this one may happen. They will begin to understand it better. Not just to come and just talk, you go. You talk to yourself and do what? Go. They will go and continue their what? Lifestyle. There will be no lifestyle change. There will be behavioral change because you talk to yourself, you spoke to you just came, blow grammar, spoke to yourself, and go. Three of us. Good. Now, another principle is this. Principle of cultural sensitivity. Principle of cultural sensitivity. This principle is very, very important. This principle emphasizes the importance of taking into account. This principle emphasizes the importance of taking into account the cultural values and beliefs of the individual. It takes into account, it emphasizes the importance of taking into account the cultural values and beliefs of the individuals and the communities being served or where you are giving the word health or education. If you just come from nowhere, if you just come from nowhere, people that don't believe, people that have the culture against certain things you are saying, hope you know that they are culture like that. They are culture that they have no business with blood transfusion. There are beliefs that have no business with blood transfusion. There are beliefs that have no business with maybe they are doing genital mutilation, and you come and be talking about female genital mutilation without trying to find out, have a kind of a balance, or what is it called, align with them, understanding their own perspective first before you start talking to saying what they taught you in school. Yes, you'll be trained, but when you come to a particular community, try to find out their culture. Be sensitive about their beliefs and their culture. If not, you will stand there, they will be there. You do your own and go. Whatever you say, they useless to them. See, belief system is very strong. People's belief system is very, very strong. That you can't just, it's not just what you just take away from them like that. Psychologically, it affects them. So it's not what you just come because they train you in maybe London or one country. You think you know it, or if you don't know, if you're not sensitive about their culture and their belief system, whatever you are saying is not. You are talking to yourself. When you are done, you go. You continue from where they do what you stop. So you must find a way to acknowledge first. What am I even saying, sir? The least they can do to you, the least is not to listen to you. There's a community you go. Before you finish, you start looking for your head, sir. So after the talk, the head will do what? Disappear. Because you refuse to, pay attention to the culture and belief system of the community you came to do what? Educate. So this is very, very important. Tomorrow you see yourself in that shoe where you go out to talk to people. Please, I beg you, try to understand where the person is coming from first. Apart from anything, people may have issues bothering them. Even when you are discussing with the patient one-on-one, people have issues bothering them. Try to find out where the person is coming from first, before you know exactly how to do what, help the person. But if you don't understand where someone is coming from, there's no way you can help that person. You will stop your own and go. So the same thing happens here. So if some community that are gentle ones, gentle community, peaceful one, we just keep quiet and looking at you. When you are done, you go. They know what they believe in. But the one that are violent, if they don't arrest the person, they will beat the person up. Because the person succeeded in saying what they considered what abominable. True of us, what they considered abomination in their community. The early missionaries saw them dying like that. Hope you know. Are you aware? Yes. The early missionaries in the Christendom, so some of them died like that. Maybe the host community were violent type, because they say to them, they were talking to them to come to Christ, but they end up losing their life because they annoyed them. And so please, it's very important we are sensitive to that. Now, so I want us to now go over to that is all for the principles of what? Principle of what? Health, what? Education. Is it good?
Yes, sir.
Now, let's look at the scope of health, what? Education. Scope of what? Health, education. You're distracted. What is that? One thing for my kids. You're distracted. And I don't like it. Don't talk about this place again. Please. Don't. You've got to access your phone. All right, so scope of what? Health, education. All right, the scope of health education is broad. Scope of health education is what? Broad. It encompasses a wide range of topics and issues. So let's look at them. The ones we can look at now. Let's look at the first one is what? Health promotion and disease prevention. Two of us.
Sure.
Yes. As you educate the community or individual, it can be done through health promotion, and if you teach them how to prevent disease, is that not health education? Is health what? Education. Another one is what? On a general note, we have the health education proper and the health literacy. On a general note, health education and health what? Literacy. We also have health behavior change and maintenance. Health behavior change and maintenance. Maybe if you, something like a smoke cessation program now. Am I complicating? If you carry out something like smoke cessation or even alcohol, you may design a program for individuals or community, for individuals to stop smoking or stop taking alcohol. You know, it should be a program. It's not because it's not what you come and tell a person. Stop smoking. If you stop smoking, if you keep smoking, you develop cancer and you go. And the person will say, hey, I will develop cancer, or let me stop it. It's not true. I come and say, from nowhere, I come and say, stop taking alcohol. If you don't stop taking alcohol, you will develop liver cancer, hepatitis, liver cirrhosis, and your liver will inflame, and you will die. And the person will say, oh, if I don't stop drinking alcohol now, I will die. If you see alcohol, you say, no, it's not true. In fact, that's when the temptation of alcohol will increase. True or false? So, these two things is not what you stop, bam. It's gradual process. That's why you design a program to help the person to do what? Stop it. And apart from even not being able to control it themselves, if they stop it, bam, abruptly like that, that's what is called withdrawal symptoms. That one is even the worst. They may even have issues if they stop it like that. So you design a program to be able to do what? Help them do what? Achieve that. So, and that borders on health behavior or change. Even what I even say is sorry, I'm using that as an example, but I think I have to say it. Do you see this thing now? You know what you stop now because I said it. It cannot work. It cannot work. You are willing to stop it. It don't work. You may start. If I take today, okay, you may start by okay, let me have a timetable. Should be I take it every day, right? Okay. Now let me take it twice a week. It's okay. I will take it today. If you have the urge to take it, you say no. Should be I take it every Friday. No, don't worry. Friday I will take it. Gradually, you may say, let me even try not to take it a week. Let me see. You see yourself a week, you not take it. 2 weeks, you will not take it. You see yourself 6 months past, you will not take it. That's how it works. So the point I'm making is that
1 to 6.
okay. The point I'm making is that health behavior change and maintenance is part of what? Health education. That's the point I'm trying to make. And I have explained what I mean by health behavior change. Now, when you now go into health disparities, preventing health disparities and health inequities and other things with respect to the environment and the other factors. Give me that food. Give me that food. Bring that food. Bring that food. Give to me now. That thing should wait. Give me.
Please,
No.
I can't wait for this one. I said to you, I will pay my school fees.
If you go outside, don't come in again.
I will not go outside.
Don't eat in my class. It's wrong. Please focus on what you are doing here. Now with this, now draw a curtain on the what? Scope of what? Health what? Education. Now let's look at functions of health education.
Is it only two?
I mentioned three. Is it material now?
Okay.
I mentioned three or four. Sir. There are four, right?
Two.
Now,
Health promotion, health literacy.
Hello, you left us for some minutes. You came back. You left us over. There are four in number I mentioned here.
No, it's three.
Are you talking about the scope?
Yes.
Scope,
The
yes.
scope is three.
health promotion, this is
I talk about health disparities and health
No, health promotion and
Inequities now.
prevention is one.
health disparities. Health disparities and health inequity. What do you understand by disparity? I think we have discussed this all over and over again. Disparities.
You said it's
So are you talking about the scope of the health now?
Yes, scope. No function now. Promotion and disease prevention, health education and health literacy,
Yes.
health behavior change and maintenance, health disparities and inequities and the inequities. Hello? What is it?
what's this?
you said function number one.
Stop leaving us, please. Leave with
I'm
us.
here now.
No, you're not.
I'm thinking of
You
this.
are not. You're not.
I'm here.
Lie, you're not. No. I will call you back again when you leave. Don't worry. I'll call you back again when you leave. I know when you leave.
Functions.
Alright, now let's look at functions of what? Health, what? Don't worry, in 20 minutes time we are done. So you can now go and rest and do other things. Health, what? Functions of health, what? Education. Functions of health, education. So through health education, we provide training on health matters. It provides health training. It provides health training to what? Individuals, communities, and healthcare professionals. Are you also aware that health education can also be provided to what? Healthcare professionals? Are you aware? Not only to clients and patients. Hope you know. Yes. Even you as a public health practitioner, you can organize healthcare professionals and sit down and tell them about, educate them on a particular public health issue. Hope you know. Yes. So health education provides what? Training on health matters to individuals, communities, and healthcare professionals. It helps in team building, and increase of the level of awareness about health issues. True of us. If you educate people, they become aware. You know, during that Ebola, COVID-19, you see health education actually fast. If not for health education, people wouldn't have been saved. True of us. Go to social media everywhere about COVID-19, health education, health promotion. People become even small children even learn how to wash their hands properly. True of us. Because of the health education program on the air, in schools, in churches, everywhere. So people become aware of what they should do to prevent, to avoid contracting the world, even though there were still some wrong education. I remember that time when Ebola started. The first thing I heard, someone who called me on phone said, "Cheta, please go ahead. Please go and buy salt. Put salt in water. Use it to bathe too." I was like, "Bathe for what? Don't confuse. What is happening?" Then I didn't know about it. I didn't know.
I heard that it gives me.
They said that. I was like, as a healthcare professional, I sat down, Do you know what I was thinking? I was thinking about the making of action. How will salt? What will salt do? That was why I didn't do that, you know. It was this happened early morning, you know. It was today the day that I now went to social media and started seeing that. I was like, okay. She didn't even know what the thing was all about. Too. She had one number that told them that there's one disease that is spread, that you should just get, if you want to be safe, just get salt, get water, just bathe with salt. I was like, he made no, some people heard it and said it immediately. I sat there, I was like, salt in water, what does it mean? Some say drink it, said, or now. How? What would I pour salt in water and start drinking? My BP will rise. This is what I was thinking. I don't know. That was in 2014. I was I will not do it too. I said, it made no sense to me because of my knowledge about health, about what salt can do to the system. That was what saved me. That was why I didn't do it. That was when I was working in one company like that. I finished my services in 2013. That 2014, yes, 2014. I can remember vividly. It made no sense to me. I was like, why would I do that? I said, no, I'm not doing it. Everybody was afraid. Hey. I said, I will not do that. My mom was panicking. I said, I will not do it too. Let me go see what's going on. I will not do it. It makes no sense to me. Are they killing me? Do they don't want me to die or what? I said, no. It's early for me to start shooting my BP. I know what salt solution can do to cells. You did your osmosis now. So I need to do it too. It was during the day when I now went online that I started studying about welcome back, young man. Welcome.
No, I'm listening.
Are you sure?
The salt solution.
Please, after you check on him, please, let's know what is wrong. All right, so now, do you now see if what it means to be awareness is very important? If you know your health, if you know about health eating, it will help you to save yourself and to also save what? Others. Now, the next one is that, of course, in all, it helps to improve health of individuals and community. True of us. It helps to improve the health of individuals and communities through education and behavioral change. It helps to improve health of individuals and communities through education and behavioral change. Through health education and behavioral change. It also helps in changing negative health behavior and promoting healthy lifestyle. This whole thing, I'm just talking about the same thing in different ways. We are talking about the same thing in different ways. So it changes negative health behaviors and promotes healthy lifestyles. Next one, that it prevents diseases. True of us, it prevents diseases, thereby promoting health and wellness. True of us, it prevents what? Diseases. At least I've used that Ebola and COVID-19, the awareness, what the health education help us, how it helps us to prevent it from. That also helped me to not to contract it. True of us, the same thing that you are here today. Some people die, I hope you know, but we are alive. So we started doing those things, doing the social distancing, other things, covering our, using masks. Some were vaccinated. Some were vaccinated. All right, the next one is that health education help. Listen carefully. Health education help in the development and implementation of health education programs that meet the need of diverse population. It helps in the development and implementation of health education programs that meet the needs of diverse population. It's not when you are a health educator, that's when you know the type of program to design. Two of us that will meet the need of people. Two of us. If you are not an health educator, if you are not knowledgeable in health education, will you be able to design such program? Because the knowledge of health education you have acquired is the one helping you now to design those programs. Two of us. I think I talked about smoke cessation program, alcohol cessation program. If you are not grounded in health education, you're not able to do what? Do that. Two of us, plus psychology too. Hope you know. That's why you're doing psychology. Plus what? Psychology. They work together to be able to design a program. Because for you to help a smoker to stop, you must play on his or her psychology a bit. Yes, you must have to do that. Make him see reasons why you should stop it. It's not by force. Am I committing?
Yes, sir.
It's very important you know that. So that's why you are doing psychology. So take it seriously. It's not just about passing the exam. It's about learning what you're supposed to learn in it so that you can use it, apply it in whatever you are doing. That's how I will interact with you. What you talk, tell you what I see, I've seen in you, and what you are doing. If you're not careful, you think I studied psychology as a course. Welcome.
Yeah.
Some people that don't even know me in terms of my profession, think I'm a psychologist. No, because of the what this profession has exposed me to. Am I communicating? And that's why I can comfortably handle it. I didn't study it as a course, but I know that health care profession is an integrated course where you do a lot of things to help you, because human being is complex. Human being is the most difficult organism in the world. Even the Bible said that God did what? Regretted what? Created what? Yes. Human being is the most difficult to manage. As simple as this small girl you're looking at, the person is complex. That is not just one factor. That is what a lot of factors contribute to the person's behavior and the person's action, even at a particular point in time. Even what the person will do in the next 2 seconds, a lot of factors it can change. So that's why psychology is very important. So not just psychology and health education, two they combine together. You can help to design this program and implement it. So have you now seen how what health education is doing in that regard? Am I completing? Good. Now, next one is that it helps in evaluating the effectiveness of health education program and making recommendation for improvement. Yes, it's not just about the program. It's also about monitoring the two of us, see whether the purpose is achievable or is achieved already. Two of us, yes, to see, monitor the program, see how effective it is. If it's not effective, one thing is not about designing something, how effective it is. Are you aware that who can tell me the difference between efficiency and effectiveness? If you get it, I'll buy something. Who can distinguish? Don't look at it, just distinguish between effectiveness and efficiency.
Effectiveness. This is when something is really working, like it's effective.
So whether it's working or effective. Who can distinguish the effectiveness and the efficiency?
Grammar.
Even if you cannot explain it by, you can use example. Just if you use example, I will know whether you understand it.
Efficiency is like having enough of it, enough of something, like in multitude. Effectiveness is how it works perfectly.
Who else? I did some. I think who else?
So we should use any kind of example. Mila is having a and it takes paracetamol. So the paracetamol has is effective on him. While efficiency, Chisom has.
Okay. The other one. Let's not lose that. And we have 6 minutes to go. Now let me explain. Let me use my lecture now. This lecture as a lecturer. I may be efficient, but I may not be effective. For example, now, what is the purpose of this class? Lecture is for you to understand. You know that, right? I can be here. The time for our lecture is 6 p.m. 12 p.m. right? I can be here 12 p.m. dots. Everything is set. I will teach. Your material is ready. Everything is working perfectly. But I may do all these things and go. I'm efficient, right? But effectiveness now determines you that you that listen to me. Did you understand what I was talking about? I'm efficient and so I talk to myself for 2 hours and go. And you will ask, what do you say?
Does it have positive effectiveness?
I don't know. I felt don't you know what was it? What did this man just do for the past 2 hours? Nothing. Am I complete? Work done, 0. Because the purpose for my coming here is for you. So that's about you. Okay, now let me use another scenario. 2 of us are working for. Two of you are working for my company, a marketing company. I have products, I market. You come to work 8 a.m. work out, carry products. You are jumping from hospital to hospital. It may be drugs. You are going to hospital. Let me use drugs now. Maybe I have a pharmaceutical company, and you are my medical sales rep. You are my medical sales rep. You have your territory. You have a territory, or you are even working in the same territory. In the 8 a.m. you are in the office. You prepare, wear your tie, dress properly. Of course, company will give you car, flashy car, neat, clean. You pay for yourself. You are presentable. Everything is intact. You can speak, and you go from one hospital to hospital, blowing ground up and down, telling them about the product, and they clap for you. This product is good. And this person may be the same thing, or it may not. But at the end of the month, you are bringing in 20 million. You meet your target. You are bringing 20 million to the company, and this one is struggling with 500,000 company. Sorry. You will not even be coming to. You may even stay in your house and be linking up with doctors through your phone. Say, doctor, how far now? This product, please now. We are not seeing that one. You are doing background. You may even go to doctor, if you visit the doctor, stay doctor, please. At the end of the month, it's you. You may be bringing 20 million to the company. But this one that comes every morning with suits, wasting our fuel, jumping from place to place. In our own criteria, our focus is money. Remember, it depends on what we want to achieve. What you need is that money. And she brings in 500,000, and she may even be owing because of those she supply as you be bringing 20 million cash. Tell me, based on what you want to achieve, the criteria we are using as a company, money. Who among 2 of you who is more effective? No, you are the one that wanted to 20 million. Who is more effective? It's not efficient. It is efficient. Am I communicating? But you are more what? Effective. And if the company want to rate those that are performers, you should the company know. It's not that one that look touched. You may even be wearing jean and the polo and be jumping from one market to another market. Be dragging with all these business people. You are able to fight them. No time for suits for you. Is to you, it's rugged. We rugged it. Let's get the business done. But at the end of the day, she's bringing 500k that cannot even pay her own salary. When it is time for payment, company will ask her, Madam Alpha, how do you pay your salary? But your own, the money you brought in is paying the whole salary of the staff. You see that company will be, even though you will be stubborn, even though you will be rugged, company will say, please keep her ruggedness for us. We love her ruggedness. That's what they care. We love our what? Ruggedness. So the point I'm making is this: for you to be effective, even as a sales rep, know what your company wants. Ask yourself that question: what does this company give it to them? You become the top, the highest performer. Three of us, the same thing. Bring it down to health education. It must be effective. What do they need? What do they need? Do they need to understand this? They need to understand this. Three of us. Good. If they are not they did not sit down here to watch you blow grammar, or you are not here sitting down here to watch me tell you how good I am. No, you are here for me to help you understand this course. So if I fail to help you understand this course, whatever I'm doing here, I did here for the past 2 hours, I was not effective. It's now when you now start, why am I not effective? You now start, the student contributed, but the point is that the class was not what? Effective. Does it make sense to you now? So that was, even though I'm efficient, but effectiveness there is zero. But it's always going to be both effective and what? Efficient. So the last one I wanted to look at. Okay, there is nothing much again, much to say there. Any other thing is in the course material. Any question? Any question? In our next class, we'll look at delivering training and health education for PhD workers. That's the next topic we will treat. That will be next week. Remember our quiz on Monday.
So the quiz will be based on what?
Based on what?
We don't have any lecture aside this one.
Based on what?
No, I mean.
Okay, sorry, let me explain. Sorry.
Yes,
My quiz. Whenever I say quiz, let's assume now, the quiz I will do Monday now can come from everything we have done. Whether question has been set from that topic.
or not.
Whether question has been set from that topic before or not is inconsequential. So far we have done it in class. So the one for next week now, everything we have done in psychology, go back and study it again. Next week again, you still go back and study because question can. So far we have discussed it in this class. I'll keep setting questions, so you keep going back and forth, so you don't forget. I cannot tolerate anything less than 17 in exam from anybody. If you score 70 or 100, I will not be happy with you.
So this particular one is ours.
Which one is which one?
The one that we are writing this semester is over what? The other one is about 40 now.
Which one? You mean the exam?
Yes.
Your exam is 6% now. And the average of all your CAs is 40%. Your mid-semester is 20%. All these quiz you will be writing, the average is over 20, making your CA 40%. All the quizzes will come under 20%. Your mid-semester 20%, CA 40%, then your exam is 60%, everything is what? 100%. So that's why every week you see your cumulative CA. You keep seeing it every week. So if you are passing, you know. If there's red in your just know that you have already started failing. You try mathematical to avoid red. Because if you're not careful, that red will enter exam. Is it clear? Alright, I think we'll stop here. Any other question? In the absence of any question, I think we'll stop here. We'll try for today.
Thank you.
Thank you very much for your attention. God bless you. See you next time.